Let me now talk about vaccination. As DMS have mentioned, we are making good progress. Latest data, 81% of our population completed full regimen. 84, and in fact over 84 have received one dose. That means at some point, probably within this month, we will have maybe about 85% of our population having received 2 doses, which is really quite a high rate. More importantly is the booster program now. The Delta variant is a lot more infectious, as we know, and is transmitting all over the world. It has become the dominant variant in many places. There are a few clear observations from international data as well as our own data. First, there has been more breakthrough infections where fully vaccinated individuals are infected with the Delta variant. Vaccines still protect a person against infection, but the strength of the protection will come down as antibodies wane several months after the vaccination. In Singapore, our data shows that the ability of vaccination to prevent any COVID infection is around 40%. Second observation is, despite this, vaccines continue to be very effective in protecting against severe illnesses and deaths should you be infected. In fact, we report these numbers every day. So for the past 28 days, as mentioned by DMS, percentage of vaccinated people infected with COVID-19 who get very sick or die is 1.3% compared to 9.2% for unvaccinated people. So 7 times less, sometimes it's more. This is because even when the antibodies wane, there are memory cells in our body that has learned how to produce new antibodies the next time they meet the COVID-19 virus. They recognize it and they produce new antibodies. So your antibodies wane doesn't mean that you cannot protect yourself against severe illness. You have memory cells who have learned how to do this. So it's a little bit like going to school. I asked my doctor colleagues whether I can use this analogy and they say it's appropriate. So it's a bit like going to school. When you prepare for exam, you cram a lot of facts in your brain. And then after you take the exam, shortly after that, you forget all the facts. But you are still left with a very valuable education, skills, knowledge that you can use for the rest of your life. So producing antibodies is a bit like preparing for exams. Cellular response through memory cell is like your underlying education. Yeah, it's still very valuable. Notwithstanding this, recognizing waning immunity and increasing breakthrough infections, a few countries have decided to start vaccine booster program. And this is to preempt a very sharp rise in breakthrough infections, which can still mean, in absolute terms, many people can fall very sick or die. Yeah, so the percentage of people who are vaccinated who fall sick if they are infected is low. But if your infection numbers go up very, very high, in absolute terms, you can still be looking at quite a number of people falling very, very sick or die. And we want to preempt that. And this is especially relevant to elderly and to other higher risk groups. Israel, for example, has started booster program for all ages. UK, Germany, France will soon start for seniors. The US FDA has also approved a 3rd dose for immunocompromised individuals and is considering their recommendations for seniors. We announced at the last press conference that our expert committee, the EC19V, was reviewing our national strategies to boost vaccine immunity. And since then, the EC19V has observed data on the waning of immunity and the safety and efficacy of booster doses administered globally, and it has now provided its first set of recommendations on the need for booster doses for various subgroups of the population. It has recommended, and MOH has agreed, to administer a 3rd dose to the following 2 groups as the first step. First are immunocompromised individuals, And this should start from 2 months after their second dose to ensure an adequate protective immune response. In the coming weeks, we will reach out to these individuals through their healthcare providers, as they would likely have regular follow-up with their doctors. So it's quite an involved exercise. We don't have a database of them and SMS them to invite them for third dose, but we have to reach out to them one by one through their doctors. Second group are seniors aged 60 and above, and residents in aged care facilities. The EC19V has recommended that they should receive a third mRNA dose 6 to 9 months after their second dose. As some of them has received their second dose in around March this year, so we will begin to invite individuals in this group within this month, the month of September. So all our uncle, aunties out there, pachik machik out there, when you get your SMS invitation, please MOH recommend that you go to the vaccination center and get your third dose and make yourself stronger and more resilient towards the virus. The EC19V will continue to review the evidence and data for other groups. One area the EC19V will pay specific attention to is the rare but more severe adverse reactions to vaccines, which occur mostly in the younger age group. Yeah. Another area will be the effectiveness of heterologous strategy. That means you use a different vaccine as booster from the vaccine used for your primary vaccination, the first 2 doses. Yeah. So a bit of mix and match strategy. Many parents have asked me about vaccination for children. I believe this will happen, but it may take some time because clinical trials are ongoing for those aged below 12 years to ensure that the vaccines are safe and effective for children. MOH expects vaccination for children to start early next year after the studies are completed and regulatory approval processes are carried out.